Great to be here. As I said, I'm a physician, and I'm going to just talk to you today about how we've been using MXR for our hospital. So these are my disclosures. So my objective today is to define medical extended reality, and I think we already did that. Talk about its applications for training and clinical care, and then a little bit about our MGD MXR lab, I think, which is one of the first in the country that is actually using this in a hospital to try to explore how we can improve healthcare. So I think everyone here knows what mixed reality is. There's the real world, the virtual world. And the question is, can we now work with that in medicine? And there's an entire area now called medical extended reality, MXR. And that's really the combination of the virtual, augmented, and then mixed reality, where you're actually bringing devices in to work on stuff. And now you've made it in medicine when there's an association for you. So there is the AMXR, it's the American Medical Extended Reality Association, and in Europe there's something called Shift Medical, and they also have a congress that they hold every year. So this is a growing thing. 100 years ago, the family medicine first started, and they had their first journal. Nowadays, it's virtual reality. Now we have our new journal, and 100 years from now, we'll see where this goes. And as was stated before, there are actually now 2 peer-reviewed journals. And medicine is actually very important because data is important, validation is important. So these journals essentially hold truth to what we're trying to do, and validate what we're trying to do. So the Journal of Medical Extended Reality and the JMXR, which is out of Europe. So I'm going to now go through each of the different things I was talking about, the training and the clinical care. For training, we use it for lectures. So I actually, probably about 10, 15 years now, I've been using immersive lectures to teach the medical students. And then simulation training. And very important in medicine is to be able to practice and to do things. And so in a virtual environment, you can practice and do things. So can you simulate the equipment? Can you simulate the environment? Can you simulate the procedural steps? So let's talk about education. And really, sort of at the earliest levels of medical training now, you can now use augmented reality to teach. So this is from Case Western. I know many of you have probably seen this, but you can now wear a HoloLens and then learn anatomy. And at Case Western, they've had a partnership with Microsoft, and they developed this application so that they can train all the medical students to learn anatomy. The advantage of this is they've now actually eliminated the entire anatomy course, so there's no gross body dissection that occurs anymore. They take CT images, they recreate them, and then they have students essentially work in groups. For them, COVID was actually good for them because just when they released this, COVID hit, and so when all the other medical schools in the country closed, they shipped out all their HoloLenses to their students, and each of the students put their headsets at home, the professors put their headsets in their home, and then they were all able to learn, all in the same virtual space. The next thing I want to talk to you today is about simulation training. And so when we first started our journey into MXR, we started off with this, and so we got a small grant to buy a bunch of GoPro cameras. This is my colleague, who's now at Beth Israel, Colin McCarthy, who's now videotaping in a first-person view a G-tube placement. And so this is very valuable because now you can take that, you can give the video to students. So this is me for my lectures. I no longer have PowerPoint lectures, I now have immersive lectures. So I actually have the students scan a QR code using their own phone. They take their phone, they put a little stereoscopic viewer on the phone, that's what they're looking at, and then they're able to view what I want them to see. And so here's a sample lecture where I give them a little history of a patient, I show them the axial CT images, and then, the most ideal scenario is that you then go to the location. And so we say, let's go to the IR suite. And so that's what they do, they scan the QR code, and this is kind of what they see. So this is our actual IR CT suite. For those of you who have not been to Mass General, this is an actual suite that we use for our procedures. You're able to look around the room. I'm able to quiz them. I'm able to say, okay, what's that machine there? What's that CAT scanner used for? What's the ultrasound machine used for? What's that table for? So it's real-time teaching without actually taking the students to the patient areas and being able to teach them. Now, once you have the entire environment, the next thing is equipment. Can you simulate the equipment? So there was this application that we had called Clone that allowed me to put each of our devices onto this little thing and then scan it. So I was essentially creating a 3D model of these devices, and it actually takes a few moments, but this is essentially what it looks like. So the 3D model is now next to the real biopsy needle, and the 3D model actually looks more realistic than the actual needle. And so we scanned a lot of our products in, and then we said we created a library of them. But the question is, what's the value? What's the value of having virtual equipment out in the ether if you really cannot interact with it? But hey, you can interact with it. So there are devices here, just like this. This is actually from Amazon, a $25 thing you can actually get, where you can actually overlay virtual devices, virtual items onto a physical device. So you can actually then grab it, hold it, play with it, turn it, and do whatever you want with it. So this is where, for the first time, you can actually meld virtual equipment with the ability to hold it. And so there are companies out there that are now exploring this. So this is one company that is using it to train OB stuff. So there's a mannequin that's a pregnant woman, but they're able to put a HoloLens on and see a situation. So they're presented with a situation, and the situation that's presented to them is different but they're actually able to interact with the mannequin and learn from that. And nowadays, at all of our meetings, we now have virtual reality sort of included. Back in 2018, at our Society of Immersive Radiology meeting in Los Angeles, all the attendees were handed out these little Google Cardboard glasses. It allowed them to view videos like this. So this is Dr. Haskell, who's one of the editors of our journal, who's now teaching trainees how to do a TIPS procedure, very important procedure in IR. So one can now put a headset on and view these devices, view this entire procedure, and you can see how does Haskell do his TIPS procedure, what are all the different techniques. But the advantage of immersive reality is here, you're not seeing a 2D video, you're able to look around the room, you're able to see what the nurse is doing, you're able to see what the tech is doing, you're able to be as though you're actually in the room experiencing the whole situation. Now, a lot of companies have realized the value of this, so now when we go to a lot of our meetings that we have, a lot of companies have their software that's loaded onto these devices so that people can train. So when you get a new device or a new product and you don't know how to use it, instead of sending a rep out there to the hospital, you can actually now send a headset and a bunch of handsets and then have them train on using their products. Now I think we talked about digital twin. I don't know if this is the same thing that we heard before, but at our hospital, this is sort of a practical use of augmented reality. What Natalie and Johnny here have been doing is they've been actually scanning in our orange emergency boxes. And so these boxes are used to train and contain all the relevant medications that one needs, epinephrine and all these other drugs. But to train someone, you've got to open and break open one of these, and that's $400 per box. So that takes a lot of money that's essentially wasted. Why not create a digital twin of it? So this is on the right side is a digital twin, and you can see if you scan your QR code, you can actually probably even get access to this digital twin of this tackle box. We call it the tackle box. And so all the equipment that's in our tackle box, one can now interact with it. They can pull out the EpiPen and see what it's like and learn how to use it. So again, very useful. And things like this, we're going to deploy at our hospital so that the entire set of employees that need to be trained in terms of ACLS and all this stuff can get trained before they go to an ACLS course, can get trained in terms of looking what these devices look like. The next thing is really interaction and assessment. It's one thing to just see something, but can you interact with the environment and work on it? So I applied for a CRICO grant, which for those of you that don't know, CRICO is a malpractice insurance protector, and they offered yearly grants for improving patient safety. So I submitted a proposal saying, hey, I can build a liver biopsy module, and the purpose of this module is to train our trainees how to do liver biopsy. So if you wear this headset, you will know all the different steps of doing liver biopsy, and you'll be in an environment, and we've essentially replicated what our CT suite looks like. And those images that you see there are actual images that I had provided to the company to help me generate the lesion and the entire anatomy that's there. So not only have we learned that this is actually very useful to help train people, but it also allows us to do assessments of trainees. So now when trainees come, they can put the headset on, I can have a bunch of them put the headset on, and I can then quickly tell who's good and who's not so good. And then we can say, okay, you can go home with this headset, why don't you practice doing liver biopsy overnight, and then come back to us the next morning, and then maybe we can work on a patient. So other institutions have also learned the value of this. So this is now combining a mannequin with a room and interacting with it. So this is now much more realistic, and there's now sort of a movement towards bringing in entire environment. So here is from a video from Loma Linda, where they're now sort of training you, okay, how do you interact with a traumatic situation? You're there, you're seeing the blood pouring out, a little graphic there, and can you save this person, and can you save this mannequin? We also have a small room that we now dedicate in our lab to be able to do this, and really the ultimate goal is this. You know, in Star Trek, I don't know how many of you guys have seen Star Trek, but there's something called a holodeck, and holodeck is a room where the entire environment has now been converted. And so our goal in the next couple of years is to see, can we build a holodeck? And the advantage of having a holodeck is it's no longer one individual wearing one headset interacting, it's now a team of people working together to do stuff. So that's what I have for training. I'm going to now sort of transition to clinical care and just show you how we're using this clinic. So first, clinic, the way we've always done clinic for hundreds of years is to sit with a patient like this, pull up an image on a 2D monitor, and then go through the anatomy. But why not be more elegant? So here, these are two volunteers really, viewing their images. And so you can actually take a patient's actual image, create a 3D model of it, and then I do something called an ablation procedure, which is where you stick a probe into the liver and you burn it or freeze it. So here I'm actually showing the patient how I'm going to reach them. And so it's much more dramatic for the patient. They're no longer trying to understand what a 2D coronal or a 2D axial image is. They see their floating organ, their organ in place, and they can see where I can stick the probe in and either biopsy it or treat it. The other way we're using it is to actually help patients get oriented to the environment. I think when a lot of patients are scheduled to come to the hospital and have a procedure done, they're always very anxious about what it's like. And so this is a patient perspective view of a CT scan. So this is laying on the CT table, and you're able. We've got a 360 video of a thing on the scanner, and so you're able to pretend. Okay, what does it feel like if you're on a scanner, laying down, going into the gantry there? And so this is one of our team members, Eleni, who has been helping us. So she has been going around with Celine, which is really a 360 camera with a little gown on, all around the hospital, just getting 360 videos. And the purpose of the 360 videos is to tell people, okay, when you come to the hospital, this is what you experience. When you come to Mass General and you're in the check-in area or you're in the IR suite, this is what you can see, this is what you'll experience. The other way we've been using AR and VR is for consultations. And this is with a company that we've been working with called Uppot. And they developed a software that allows you to sort of create a virtual reading room. So for radiologists, we are always sitting at a monitor reading images, but why not have a headset and sit at home or sit in your office and do the same thing? And this is one of the FDA approval kind of issues where in Canada, this has been approved by their FDA, and so the radiologists that are using it, they're now trying to get that here in the US to get it approved. And so we're working with them to see if we can do that. And so this is actually one of our studies that I think they'll be using for their approval, just testing if do radiologists like it, is the workflow fine. Now what they've also done is they've actually started looking at the Apple Vision Pro. And so this is the Apple Vision Pro of their same software. And it was very interesting to use because for the first time as a radiologist, we're so used to using a mouse and clicking and things like that. But with the Apple Vision Pro, the gestures are different. You're clicking down here, you're using your eyes to select things. And so I really think it will revolutionize how I as a radiologist will practice, because it could be much faster. I can just look at the stuff and I can scroll or window level however I want. Here what he's showing is that you can actually have the entire EHR, the images, and the dictation software. So the goal ultimately is that if you have a headset, you can just sit there and just go through dictation. So again, workflow efficiency is very important. We are so overwhelmed with the number of images we have to read on a daily basis. So if you can make things more efficient where people are sitting in their offices and they're able to dictate through a study very quickly, then it makes things much more useful. And then finally, for me, the most important thing is how can this be used for procedures? We do a lot of procedures. So there was a collaboration that Microsoft and Philips had in terms of seeing can it be brought into the IR suite for different things. And so here you can see, instead of having to look at a monitor that's out off to the side, why not have a three-dimensional floating image in front of you so that you can do your angiogram and not have to be distracted by looking somewhere else. And so they're working on developing this and testing this. The holy grail literally of IR, of procedural use in this, is the ability to overlay. And this works well for neurosurgery and in spine surgery, mainly because the organs don't move so well. But the ability to take a patient's MRI or CT image, put it in the correct plane, fuse it and co-register it to the patient. This now is very helpful because you can now do the procedures much faster. You're not using much radiation to do the procedure. And so I think there's a lot of promise in this. But again, there are limitations. You know, the spine doesn't move, so it's easier. The brain doesn't move, so it's easier. So there are companies that have already developed this, and there are neurosurgeons in Mass General currently using it for neurosurgery. I use something called liver ablation, which is going in and putting a probe into the liver and then burning. And I was shocked to see that someone had beat us to it when they used augmented reality to do liver ablation. And so this is a group out of Italy, and so they were. So the limitation has always been that there's movement. The liver may move, so you can't really move a needle if the liver underneath your image is moving. And so they were able to use these things like QR codes to be able to detect the motion, and so that allowed them to target a lesion. And then finally, a few minutes, I know we're running over, about our lab. So this is our lab. We were given space by our chairman, the Department of Radiology, Dr. Brink, to have this lab, an entire second floor that we have. This is a group of people that's growing by the day. Our really main goals are research collaboration, AR consultation, product development. There have actually been several articles now written about us, especially I was most excited about the Wired article that just talked about what we were doing in our lab. We do have support from the Department of Radiology, grants, corporate collaborations, and then consultation services. This is sort of a small list of our grants, but what I'm excited about is that we're working with a lot of physicians at Mass General. A lot of guys in Mass Pioneer and other hospitals come to us and they say, hey, we heard you have a lab, can you help us? And that's what we want to be. We want to be a source for knowledge, a source for equipment. So a lot of these guys come to us. So the first project that I'll just quickly highlight, Dr. Eckler from the Mass Pioneer, he realized that a lot of his patients had this issue where when they walked into a big room, they would suddenly get very dizzy, and there was a middle ear issue that they had to address. As a Mass Pioneer doctor, it was a big issue for him. So he said, why don't we test whether we can use the augmented reality HoloLens to essentially take in a real image, stabilize it for the patient, and present it to them as a stable image. And so, and again, that's using AI. It's trying to learn what's the deformity in the middle ear that prevents them from seeing things without it being unstable. And so, again, we were able to help them with this grant. And so, and then we, as I said, in medicine, the critical thing is you've got to publish and present. And so we have several publications, and no doctors will accept this unless you have publications showing that it works. So that's all I have for you today. Thank you very much.